Understanding anxiety disorders, signs, symptoms, and treatment. Anxiety disorders encompass a range of mental health conditions characterized by excessive fear, worry, and nervousness. They are the most common mental health disorders and can significantly impact daily functioning. Here's a detailed look at the causes, signs, symptoms, and treatment options for anxiety disorders. Causes of anxiety disorders. 1. Genetic factors. Family history. Anxiety disorders can run in families, indicating a genetic predisposition. Inherited traits. Genetic factors may influence how the brain responds to stress and fear. 2. Brain chemistry. Neurotransmitter imbalances. Dysregulation of brain chemicals like serotonin, dopamine, and norepinephrine is linked to anxiety. Brain function. Structural and functional changes in areas involved in emotion regulation. 3. Environmental factors. Stressful life events, trauma, abuse, the death of a loved one, or significant life changes can trigger anxiety. Chronic stress. Ongoing stress from work, relationships, or financial issues can contribute to anxiety. 4. Personality factors. Personality traits. Certain personality types, such as those who are more prone to stress or who have low self-esteem, are at higher risk. 5. Health conditions. Medical conditions. Chronic illnesses, heart disease, diabetes, and respiratory disorders can be linked to anxiety. Substance use. Abuse or withdrawal from alcohol, drugs, or caffeine can exacerbate anxiety. 6. Developmental factors. Childhood experiences. Early childhood trauma, neglect, or parental separation can lead to anxiety disorders later in life. Signs and symptoms. 1. General symptoms. Excessive worry. Persistent, excessive worry or fear that is disproportionate to the actual situation. Restlessness. Feeling keyed up, on edge, or unable to relax. Fatigue. Being easily fatigued despite adequate rest. 2. Physical symptoms. Tension, muscle tension, headaches, or unexplained aches and pains. Sleep disturbances. Difficulty falling asleep, staying asleep, or experiencing restless sleep. Autonomic responses. Sweating, trembling, dizziness, or rapid heartbeat. 3. Cognitive symptoms. Concentration problems, difficulty concentrating, feeling blank, or experiencing mind wandering. Irritability. Increased irritability or feeling easily annoyed. Fear of losing control. Persistent fear of losing control or going crazy. 4. Behavioral symptoms. Avoidance. Avoiding situations or activities that trigger anxiety. Compulsive behaviors. Engaging in repetitive behaviors or rituals to manage anxiety. Specific symptoms by disorder. Generalized anxiety disorder, GAD, chronic worry about various aspects of life, often with no clear cause. Panic disorder. Recurrent panic attacks. Intense episodes of fear with physical symptoms like chest pain and palpitations. Social anxiety disorder. Intense fear of social situations or being judged by others. Phobias. Irrational fears of specific objects or situations, leading to avoidance behavior. Obsessive-compulsive disorder, OCD. Unwanted repetitive thoughts, obsessions, and behaviors, compulsions. Post-traumatic stress disorder, PTSD. Anxiety following exposure to traumatic events, with flashbacks and avoidance of triggers. Treatment. 1. Psychotherapy. Cognitive behavioral therapy, CBT, focuses on changing negative thought patterns and behaviors associated with anxiety. Exposure therapy. Gradual exposure to anxiety-provoking situations to desensitize and reduce fear. Acceptance and commitment therapy, ACT, uses mindfulness and behavioral strategies to manage anxiety. Dialectical behavior therapy, DBT, combines CBT with mindfulness strategies for emotional regulation. 2. Medication. Antidepressants. SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors, commonly used for anxiety. Benzodiazepines, short-term treatment for acute anxiety symptoms, can be addictive. Buspirone, an anti-anxiety medication specifically for generalized anxiety disorder, GAD. Beta blockers, used to manage physical symptoms such as palpitations. 3. Lifestyle modifications.
Stress management. Techniques like yoga, meditation, and deep breathing exercises. Physical activity. Regular exercise to help reduce anxiety levels. Healthy diet. Balanced diet to support overall mental health. Sleep hygiene. Improving sleep patterns to alleviate anxiety symptoms. 4. Support groups. Peer support. Groups that provide mutual support and shared experiences. Family therapy. Involvement of family members to provide support and improve coping mechanisms. 5. Alternative therapies. Mindfulness and relaxation techniques. Meditation. Progressive muscle relaxation. And guided imagery. Acupuncture. Used by some to help manage anxiety symptoms. Herbal supplements. Supplements like valerian root, kava, and chamomile. Though efficacy and safety should be discussed with a healthcare provider.
Anxiety disorders are common but treatable mental health conditions that can significantly impact quality of life. Recognizing the signs and symptoms, understanding the underlying causes, and exploring a range of treatment options can help manage anxiety effectively. Comprehensive care, including therapy, medication, and lifestyle changes, is crucial for improving outcomes and enhancing well-being. Stay informed and seek support to navigate the challenges of anxiety disorders.